General adult test. This time we discuss testing the visual field. Also known as perimetry, this test assesses the extent or perimeter of your visual field. This is done routinely to determine whether you have a blind spot or more frequently if you are at a high risk of glaucoma. What to expect in the test. A confrontation test may be performed initially. Your optometrist will sit 3 feet or 1 meter in front of you and ask you to look directly into their eye or at the tip of their nose. They will then wave their finger or an object at the edge of your visual field and ask you to indicate when you can see it. While this is not sensitive enough for fine assessment, it shows any major defects. An accurate assessment can be performed with automated perimetry testing, which maps your field of vision. You will sit at the machine while a set of lights flashes at the edge of your line of sight. If a defect is identified, it is important that its size and position are analyzed. You will need to be monitored more closely to check for any change. Your optometrist may refer you to an ophthalmologist to identify the possible cause. Loss of peripheral vision severely affects ability to drive safely. The visual field map. The perimetry machine tracks the position of the lights you do not see, and in doing so creates a map that shows the area of visual loss. The automated perimetry test. If you wear glasses, the eye being tested will have your lens prescription placed in front of it. The other one will be covered. You will be asked to focus on the center of the test bowl and press a response button each time you see a light flashing. Thank you for your attention.
Let's now go to identification of patterns. Let's discuss relationships. Identifying patterns also follows the typical way of Chinese natural philosophy, which looks for relationships rather than causes. Each symptom and sign has a meaning only in relation to all the others. One symptom can mean different things in different situations. For example, a dry tongue accompanied by a feeling of heat in the evening, dry mouth with desire to drink in small sips, night sweating, and a floating empty pulse indicate yin deficiency, the more common cause of a dry tongue. While a dry tongue accompanied by a feeling of cold, absence of thirst, cold hands, and profuse pale urination indicates yang deficiency, a rare cause of a dry tongue. Identifying the pattern of disharmony blends diagnosis, pathology, and treatment principle all in one. When we say that a certain pattern is characterized by deficiency of spleen yang with retention of dampness, we are defining the nature of the condition, yang deficiency and dampness, the site, the spleen, and by implication, the treatment principle, tonifying yang and resolve dampness. In the particular case of exterior patterns, by identifying the pattern, we also identify the cause. For example, if we say that a certain complex of clinical manifestations forms the pattern of exterior invasion of wind cold, we are simultaneously identifying the cause or wind cold, the type of pattern, and by implication, the treatment principle, which in this case would be to release the exterior and expel cold. Identifying the pattern allows us to find the nature and character of the condition, the site of the disease, the treatment principle, and the prognosis. As the essentials of Chinese acupuncture points out, identification of the pattern is made not from a simple list of symptoms and signs, but from a reflection on the pathogenesis of the disease. In other words, we should not only identify the pattern, but also understand how it arose and how different aspects of it interact with each other. For example, if we identify the pattern of liver qi stagnation and also one of spleen qi deficiency, we should Go a step further and find out how these two patterns interact and whether one can be considered the cause of the other. To summarize, identification of patterns looks for relationships rather than causes. Identification of patterns blends diagnosis, pathology, and treatment principle all in one. In exterior diseases, the identification of patterns identifies the cause as well as external wind. Apart from identifying the pattern, we should understand its origin, development, and relationship with other patterns. Thank you for your attention.
Let us proceed to foot tie-in spleen meridian. This time we discuss spleen 10, Shi High, sea of blood. Located on the medial side of the thigh in a tender depression on the bulge of the vastus medialis muscle, tutsum proximal to the superomedial angle of the patella. The alternate point location method with the patient's left knee flexed and the practitioner facing the patient. The practitioner locates the point by cupping the knee with her right hand. Spleen 10 lies at the tip of the practitioner's fully extended thumb, laying at 45 degrees from the index finger. The name Sea of Blood emphasizes the importance of this point in treating the blood. Although it is not included among the points for the four Cs, its name implies the echoing of some of the same properties as the sea of blood or nourishment with their connection to deep reserves. It is said to make blood re-enter the sea of blood. Blood carries the chi and warms the zang. The spleen plays a part in the formation of blood and also holds the blood in the vessels. When blood is deficient, there may be exhaustion, listlessness, cold extremities, agitation, and insomnia from the shan having insufficient blood in which to rest. Without the warming properties of blood, isolation, barrenness, and inflexibility can be evident at the level of the mind, spirit, and the body. With insufficient blood, it is hard to move from one center to consider things from someone else's point of view. It is hard to be understanding, thinking, and imagination become inert and lack suppleness. We have no strength with which to carry out our intent, and so experience no harvest. Blood nourishes us and our flesh. Spleen 10 invigorates the blood. It disperses stagnation and brings the warming, moistening influence of blood to nourish, calm, and restore. Spleen 10 is used for menstrual disorders and patterns of blood disharmony, such as heat in the blood, depletion of blood, and stagnation of blood. Clear stagnation of blood, especially in the uterus, used when stagnation of blood causes painful menstruation. So it regulates menstruation. When there is mental agitation and worry depleting the blood, this point calms the shan and nourishes blood, cools the blood, and is used to moisten when heat in the blood affects the skin, causing eczema and rashes, and also excessive menstrual bleeding arising from blood heat. Tonifies the blood, so helping with circulation, tiredness, blurred vision. Moves blood in the leg and knee, can be used for trauma to the knee or arthritis of the knee. Indications: mental inflexibility and inertia, menstrual disorders, poor circulation, blurred vision, tiredness, blood heat, skin problems. The spleen and blood are closely connected. Spleen partly forms it and holds it. Consider this point with anything associated with the blood itself. It revitalizes and nourishes it. For coldness on a mental level, such as rejection, mental rigidity, or withdrawal. For poor circulation, lack of energy, cold extremities, menstrual disorders, particularly excessive bleeding or painful periods. Indications and potential point combinations. So for knee pain, we combine spleen 10 with spleen 9, stomach 34, 36, GB 34, Xian on either side of the patellar ligament, hurting at the apex of the patella. The trigger point in the vastus medialis muscle refers to the anteromedial knee. Consider myofascial contributions to knee pain from elsewhere too, coupled with potential arthrodial problems. additional trigger points. For menstrual and gynecologic disorders such as menorrhagia, irregular menstruation, dysmenorrhea, spleen 10 is combined with spleen 6, bladder 32, 23, GB4, 20, CV6. For skin disorders, urticaria, eczema, and allergy, we combine spleen 10 with stomach 36, Li4, 11, GV14, spleen 6. Evidence-based applications. The 4 points, Li11, spleen 10, spleen 6, and stomach 36, treat acute urticaria. A case series using needling, bleeding, and cupping to treat erysipelas reported good results using spleen 10, spleen 1, and visible veins. Acupuncture at Li4, 11, bladder 13, 17, 20, stomach 36, spleen 6, 10, and GV20 provided an immunomodulatory effect for patients with lichen rubra-planus. Thank you for your attention.
Let's now go to lungs. Let's discuss phlegm retention in the lungs. This condition tends to occur after suffering repeated attacks of colds or flu without proper recovering from each attack. A simple cold can affect the body heavily. In a healthy person with a strong constitution, they are able to recover quickly, but many people will ignore a cold and simply continue with their normal stressful lives, not allowing themselves the opportunity to properly recover. When this pattern is repeated for years, all the main organs are likely to be affected, such as a person may develop poor functioning of the pancreas, lungs, kidneys, from constantly drawing on adrenaline to support their stressful lifestyle, and also stagnated liver function due to the prolonged stress. With all the main organs affected, phlegm builds up in the lungs, which are unable to shift it. In contemporary medicine, this condition will tend to be called either chronic bronchitis or bronchial asthma. The signs and symptoms could include any combination of the following: recurring or persistent cough with lots of white or frothy sputum, or a cough that is loud, barking, and painful, with yellow mucus, which may be blood-stained and strong smelling; shortness of breath, rattle in the throat, and fullness or stuffiness in the chest, sometimes with loss of appetite, nausea, and vomiting, and finding it uncomfortable to lie down. With the treatment principle, we focus on returning the affected organs to their normal function, including the lungs, pancreas, kidneys, and liver. The key acupoints do this would have become tender, and leading them encourages the respective organs to resume their normal function. This then enables the lungs to clear the phlegm and the digestive organs to function properly, which aids the patient's recovery. However, with any condition that is the result of chronic deficiencies or weakness in the function of the main organs, the condition may be slow to respond to treatment, which means that strengthening treatments could be required for several weeks, along with advice to the patient on changes in their lifestyle, which would enable them to recover more quickly. Thank you for your attention.
Let's now discuss diagnosis by 4 phases. Diagnosis by the 4 phases for warm illnesses was an approach devised by the Qing dynasty physician Yi Tianxu for the analysis of warm illnesses caused mainly by exogenous heat evil. These phases, defensive, qi, nutritive, and blood, signify 4 stages in the course of an illness and reflect 4 levels of severity as the exogenous evil progresses from the exterior to the interior. Exogenous heat evil enters by the mouth and nose and first attacks the lung. It moves progressively from the defensive to the chi phase, from the chi to the nutritive phase, and finally from the nutritive to the blood phase. As the pathogenic evil invades more deeply, the illness also becomes more severe. In this way, the illness characteristics of these four phases signify the depth of heat evil, the degree of severity of the illness, and the state of its pathological changes. When the pathogenic evil is in the defensive phase, the illness is least severe and is in the exterior. The principal organ and tissue affected are the lung and body superficies. When the illness is in the chi phase, it is at a somewhat deeper level and at a somewhat higher degree of severity. Here, the pathogenic evil has entered the interior and is affecting more organs and tissues. The chest and the diaphragm, the lung, the stomach, the intestines, the gallbladder, or other organs. When the pathogenic evil enters the nutritive phase, the location is another step deeper. The disease evil has now entered the heart and the pericardium, so that the mind is disturbed. When the illness is in the blood phase, heat evil is in the liver and the kidney, in severe cases impairing and consuming blood and making the illness critical. The following describes the basic pathology and clinical manifestations as an illness progresses through the four phases. We will first discuss the defensive phase. An illness is in the defensive phase when the heat evil has just attacked the lung and the defense phase. So the defensive chi action becomes disorganized and lung chi movement impeded. It is an illness of exterior heat. The typical syndrome of an illness in this phase includes fever, mild wind and cold aversion, sweating, a tongue that is red along the sides and in the tip, and a floating and rapid pulse. Other often accompanying them are headache, thirst, coughing, and sore throat. Thank you for your attention.
Let's now go to integumentary disorders. Let's discuss pruritus. Pruritus or itching is actually a form of pain. Many localized and generalized conditions present with the symptom of itch. In addition, pruritus is associated with many environmental factors which should be evaluated as potential contributing features. Occasionally, systemic illness may be associated with pruritus. Therefore, a careful history must precede and the physical examination. So we ask the patient for onset, was the onset sudden or gradual? Quality and location describe the intensity of the pruritus. Where is the patient experiencing pruritus? Pattern and duration. Is the pruritus worse at night or during particular seasons? Pruritus associated with scabies is often worse at night. Associated symptoms or conditions. We ask about associated symptoms or conditions, including rash or lesions, asthma, and allergies. Patients with atopic dermatitis often have a history of asthma or chronic allergies. Pruritus often occurs at the site of a rash or lesion. Precipitating factors ask about the presence of insect bites or exposure to insects. Many insect bites are very pruritic. Is the patient taking any medications, specifically aspirin, hormones, opiates, phenothiazine, B12, quinidine, CNS, stimulants, beta blockers, or warfarin? Has the patient traveled recently? Alleviating and aggravating factors. What alleviates the symptoms, like cold compress, topical or oral medications? What aggravates the pruritus, like low humidity or certain fabrics, stress, or cleansers? Bathing habits. How frequently does the patient bathe? What products does he use? Thank you for your attention.
Emergency acupuncture for acute throat pain. Acute throat pain in Chinese medicine is often associated with imbalances in the body's qi and can be linked to various factors such as external pathogens, internal heat, or deficiency. Common causes: wind heat, characterized by sudden onset, sore throat, fever, possibly a red tongue with a yellow coating. Yin deficiency symptoms include a dry throat, night sweats, and a red tongue with little coating. Phlegm heat presents with a swollen throat, thick yellow phlegm, and a slippery pulse. Practitioners assess the symptoms, tongue appearance, and pulse quality to determine the underlying pattern. Diagnosis may involve looking for signs of heat deficiency or phlegm accumulation. Emergency acupuncture may provide relief for acute throat pain, particularly if the pain is related to inflammation or lesion. We can use acupuncture points like Li4, which helps alleviate pain and tension, Lung 7, which is often used for respiratory issues and throat discomfort. TH5, located on the forearm, can assist with throat and neck pain. Additional relief methods will include hydration, drink warm fluids to soothe the throat, rest. Vocal rest can help reduce strain. Over-the-counter remedies, pain relievers may provide temporary relief. So for acupuncture, we use lung 1, SJ1, kidney 1, REN 23, Sanjiao 3, especially for pain in the tonsils. Use fog therapy. Grind garlic into a paste. Apply to the acupuncture point named Yuchi, the big muscle close to the inside root of the thumb. Fold with gauze and medicine tape. After several hours, the skin will have a water blister. Protect the skin lesion with blister tape. Add 1 part honey to 8 parts hot water. Mix it well. Hold the honey water in the mouth. Do this several times every day. Fry salt powder until warm. Blow it into the throat. The person will vomit out a lot of saliva. The pain will be reduced. For frequent sore throats, drink salt water, 100 to 300 ml, every morning. Repeat every day for 2 to 3 weeks. Cut 1 frost loofah into small pieces. Add it to water and bring it to a boil for 30 to 60 minutes. Drink the water extract. Chop 1 young loofah and make it into juice. Drink the juice 3 times a day, 20 ml each time. Add 50 grams loquat leaves and 25 grams Lophatherum gracili prong to water to cook as a soup. Drink the soup as a tea from time to time. Repeat for several days. Drink 100 grams of strawberry juice in the morning and at night. Preventive measures: maintain a balanced diet to support qi and yin, practice good hygiene to reduce exposure to pathogens. Thank you for your attention.
Let's now go to goiter, thyroid problems. Let's discuss goiter in Western medicine. The thyroid gland is situated at the front of the throat below the hyoid bone, Adam's apple, or the larynx. It comprises 2 lobes that lie on either side of the trachea and are joined in the front by an isthmus. Here we have the figure of the thyroid gland and its parts: the thyroid cartilage, the left and right thyroid gland, and the trachea. The thyroid gland is under the control of the pituitary gland. Hypothalamus pituitary thyroid axis, TRH, thyrotrophin releasing hormone, TSH, or thyroid stimulating hormone. When the level of thyroid hormones, the triiodothyronin and thyroxine drops too low, the pituitary gland produces thyroid stimulating hormones, or the TSH, which stimulates the thyroid gland to produce more hormones. Under the influence of TSH, the thyroid will manufacture and secrete T3 and T4, thereby raising their blood levels. The pituitary senses this and responds by decreasing its TSH production. One can imagine the thyroid gland as a boiler or furnace and the pituitary gland as the thermostat. Just as a thermostat cuts off the boiler when the temperature reaches the desired level, the pituitary gland secretes less TSH, thus reducing the levels of T3 and T4 when an optimal level is reached. The thyroid cannot manufacture its hormones without sufficiency dietary iodine. If a person's diet is low in iodine, the pituitary keeps sending chemical messages to the thyroid, but in vain. The thyroid gland enlarges as it attempts to comply with the pituitary's demands. A goiter is a swelling of the thyroid gland. The symptoms of a goiter include enlargement of the throat, ranging from a small lump to a huge mass, swallowing problems if the goiter is large enough to press on the esophagus, breathing problems if the goiter is large enough to press on the trachea. Goiters are broadly classified into two groups of endemic and sporadic. In endemic goiter, a whole community is affected by insufficiency dietary iodine. One common reason is that the soil in which foods are grown is iodine depleted. Certain areas of Australia, including Tasmania and areas along the Great Dividing Range, that is the Australian Capital Territory, have low iodine levels in the soil. There is also evidence of a re-emergence of iodine deficiency in cities such as Melbourne and mountainous areas and areas far from the sea are the ones most likely to be iodine deficient. However, endemic goiters tend to be more prevalent in developing countries. They are rare in developed countries because of widespread iodine supplementation. In sporadic goiter, only the individual is affected. Risk factors for sporadic goiter include family history, diet, age, or over 40 years, and sex. Women are much more susceptible than men. Goiter can be caused by a range of factors, including insufficient iodine in the diet, high consumption of certain foods that neutralize iodine, such as cabbage, broccoli, and cauliflower. Other foods, such as soy, may also induce goiter. Certain drugs, such as lithium and phenylbutazone, thyroid cancer, nodules growing on the thyroid gland, hypothyroidism, overactive thyroid gland, and hypothyroidism, underactive thyroid gland. Thank you for your attention.